Okay, chapter 38 is over mental health disorders. And the basic concepts here are mental relates to the mind, therefore, mental health involves the mind. And mental health and mental illness involve stress. Whereas stress is a response or a change in the body caused by some emotional, physical, social, or economic factor or factors. And mental health just means the person copes with and adjusts to everyday stresses in ways that are accepted by society. A mental disorder, or otherwise known as a mental illness or emotional illness or even a psychiatric disorder, is simply a disturbance in that ability to cope with and adjust to stress. So the whole person has physical, social, psychological, and spiritual part, and each part affects the other. And with mental illness, behavior and function are impaired. Okay. Now, causes of mental health disorders, um, not being able to cope or adjust to stress, chemical imbalances within the brain or the body, genetics, physical or biological factors, psychological factors, drugs or some form of substance abuse, and social and cultural factors. All can cause mental health disorders. So let's look at anxiety. Really, anxiety is a vague, uneasy feeling in response to stress. It often, anxiety occurs when needs are not met, and some anxiety is normal, but signs and symptoms of anxiety depend on the degree of anxiety. Um, the person may know the cause of their anxiety or they may not know the cause. But danger or harm, whether it's real or imagined, is sensed, and then that person acts to relieve that unpleasant feeling. Um, a stressor and levels depend on the stressor, and a stressor is just the event or some factor that caused the stress to begin with. And we use coping and defense mechanisms to relieve our anxiety. Some are healthy, some are not. And people with mental health problems, though, have higher than normal levels of anxieties. And like signs and symptoms of anxiety include like they might feel a lump in their throat, or they have butterflies in their stomach, and their pulse will be rapid, and their respirations will increase, and their blood pressure increases. They speak really, really fast, so they can have uh, speech changes, or their voice changes, or their mouth gets dry. They sweat. They can have nausea, or they can have diarrhea, or they might have to go pee more frequently. Their attention span is really, really poor. The higher the anxiety, the less attention span they have. They have difficulty following directions. They have difficulty sleeping, and they have a loss of appetite. So those are all signs and symptoms of anxiety, and it's listed in your under box 38.1. So the higher the anxiety goes, the worse off it gets. And the highest anxiety level is known as a panic disorder. They panic. And so panic is this intense and sudden feeling of fear, anxiety, terror, or dread. And it is the highest level of anxiety. And the onset of panic can be sudden and with no obvious reason. Panic attacks will last 10 minutes or longer, and signs and symptoms of our anxiety are really, really severe during the panic attack. So they can experience chest pain, shortness of breath. Their heart is pounding. They feel numbness and tingling in their hands, or they're dizzy. They can have a smothering sensation, or this feeling of impending doom or loss of control. Now, panic disorders can last just a few months, or they can last for many years. Okay. Um, and the attacks can actually occur at any time. So there's no specific time, and it can even happen during sleep. Okay. So if the person knows what may trigger a panic attack, then they're usually going to avoid that spot. Like if they're afraid of, if they're afraid they're going to be, if a large groups of people that are crowded in brings on that panic attack, then they're going to avoid that. Okay. If it was the shopping mall that triggered their panic attack, they're going to avoid malls. So if they know what causes it, they'll avoid it. And even a panic attack, if uh, yeah, they can. That's pretty much it. But they really are in distress. Phobias, on the other hand, mean there's this intense fear, panic, or dread, but it's of something. The person has an intense fear of an object or a situation or an activity that has little or no actual danger. And common ones include fear of fire, fear of water, strangers, spiders, night or darkness, the slightest uncleanliness, being in or being trapped in an enclosed or narrow space, being in pain or seeing others in pain, or being in an open, crowded, or public place. So the person avoids what's feared, and when faced with the fear, then their anxiety skyrockets and they can't function. Let's see. Oh, poo. Um, the next disorder that you may, so I mean, lots of people have different phobias. The other thing that comes across is the obsessive compulsive disorder, or OCD. And an obsession is just this recurrent unwanted thought, idea, or image. And then the compulsion is a repeating an act over and over again. So, like the obsession might be a fear of dirty hands. So the compulsion would then be they're washing their hands over and over and over again. And that is a common ritual. Hand washing, constantly checking to make sure the stove is off, or cleaning, or counting things to a certain number, or touching things in a certain order. And then some persons with OCD also experience depression or eating disorders, substance abuse, and other anxiety disorders. So you might come across persons with OCD, or you might know someone who has OCD, or you have OCD. The compulsions really don't make any sense, but the person had a lot of anxiety if the act isn't done. Um, and some people just become obsessed with microbes, dirt, violent thoughts, or things forbidden by religious beliefs. I did take care of one particular person long ago when I worked in acute care who had OCD. I mean, it was to the point that, and hers was the hand washing. I mean, she had this obsession about microbes and dirt, and so she would be constantly washing her hands. Well, the point was, your skin can only take so much, and her poor hands were just, oh, they were almost to um, where the skin was coming off. I mean, it was peeling, it was red, it was miserable for her. Um, but these rituals, even that one, I mean, that was all she wanted to do it all the time. But compulsive rituals can take over an hour every day. They're just very distressing, and so they affect the person's daily life. Then you can come across persons who experience PSTD, or post traumatic stress disorder. And this can occur to anybody. I mean, we hear a lot about it from military because they've experienced so many things that are just so traumatic and out of the ordinary for here, but it can happen to anybody. This can happen to anyone, and it really occurs after a terrifying ordeal involving physical harm or the threat of physical harm. Okay, and most people with PTSD have flashbacks, and a flashback is just reliving that trauma in their thoughts during the day, or in nightmares during their sleep. And the flashback can involve images, sounds, smells, or feelings. So everyday things can trigger these flashbacks. And when they're having a flashback, the person just basically loses touch with reality at that time. So they believe the trauma is happening all over again. So signs and symptoms really develop over a few months after the harmful event, or not until years later. It just depends on what it is and how the person coped with it. And the person can also suffer, again, from depression, substance abuse, or other anxiety disorders. Um, let's see. Uh, in PTSD, um, some people can recover it within 6 months, but then the condition can become chronic as well. Okay. Ow. And you've got signs and symptoms of PTSD. Um, they startle really easily. And that's on box 38.3 on page 600 in your book. You can kind of read over that. I think it's a nice to know because you never know when you come across someone who might have experienced this, and um, you want to kind of know how to if they startle easily, you want to make sure. And even people in the military will tell you, which my daughter has a husband who works in the military. You don't just go shake them and say, "Hey, can you wake up?" You gently call their name from a distance and work your way up till they're fully awake. And that is important, unless you just want to be hit or not have you blocked off. So, schizophrenia is the next mental disorder that you can come across. And schizophrenia means there's a split mind, and it can be severe, chronic, and a disabling brain disorder. And in schizophrenia involves can involve psychosis, and psychosis is a state of severe mental impairment. So a person can have a psychotic episode, which means they're mentally impaired and at a very high level. They can experience delusions, which are a false belief, a hallucination, and hallucinations are scenes. You it involves your senses, and it can involve any of your senses: in vision, hearing, your nose, smell, and feeling that something that is not real, or feelings that something that's not real. They can be paranoia, and you see a lot of time, even though a long-term care client um, who has dementia can experience some of these symptoms as well, because this is not only just to people with schizophrenia. If they have dementia, they can experience paranoia, and paranoia is a mind disorder of false beliefs, like you're going to kill them. If I eat this, you're poisoning me, that type of thing. But a person who has schizophrenia can actually experience paranoia, or they might experience a delusion of grandeur, and this is they have an exaggerated belief of their own importance or their wealth or their power or their talents. And then delusions of persecution. They have a false belief that one is being mistreated, abused, or harassed. So um, let's see. Um, an example of a delusion of persecution is when the person believes that someone is out to get them. Okay, a delusion of grandeur is where maybe they believe that they are related to the Queen of England, or they are the Queen of England. That's a delusion of grandeur. Okay. And paranoia, like I told you, poisoning, but it's also like spying on them, um, or they're being cheated, or someone's plotting against them. That's all part of paranoia. The person with schizophrenia, if they have severe mental impairment, they're in a psychotic state or psychosis. Again, they have this disturbed thinking and behavior, and they can have delusions and or hallucinations. They can be paranoid. They can have difficulty organizing their thoughts, and disorders of movement can occur. And some persons withdraw or regress to earlier times. In men, symptoms usually begin in the late teens or early 20s, whereas in women, symptoms usually begin in the mid 20s or early 30s. A lot of people with mental disorders don't live to be really old because they have so many other things that can go on. And then, of course, persons with schizophrenia or any of the other mental disorders that we've talked about, they're not housed in asylums. They live in our communities. Um, so you can come across them in the grocery store, anywhere. And you may have relatives who have this or uh, friends who have this. The main thing with that is, be a friend. Don't just leave them because they can, because of their ideologies that are misstrued or miscued. People don't want to associate with them, which really is so sad, so sad. But people with schizophrenia do not tend to be violent. Um, some of persons with schizophrenia, though, do attempt suicide. But if a person talks about or tries to commit suicide, you want to make sure that you call for the nurse at once and you don't leave the person alone. Okay, you wait till that nurse gets there. That's the main 2 points there. All right. Another mental disorder that you can come across are just mood disorders, and this relates to feelings and emotions. So the person with like bipolar disorder has severe extremes in mood, energy, and ability to function. So they either have very emotional lows, or they have very emotional highs. When they have emotional lows, it's the depression. Okay, it's known as depression. And then when they have the emotional highs, then it's called mania. Okay, and sometimes bipolar disorder is known as manic depressive illness. And they can be more depressed than manic, or they can be more manic than depressed. I mean, it just alternates between the two, but they can become suicidal in the process. So if the person, again, talks about or tries to commit suicide, you want to call the nurse for once. Do not leave the person alone. Okay. Now, I told you that most schizophrenics do not become violent, and they don't. But if they do become violent, it's usually directed at a family member. Depression is another disorder, um, and there's different types of depression, but major depression involves the body, the mood, and the thoughts, and symptoms can affect work, study, sleep, eating, or other activities. And what here happens here is the person is very sad and they lose interest in daily activities, and it can be caused by stressful events, or some physical disorders actually can cause depression as well. It is actually common in older persons. Um, and if you do have an older person who is experiencing depression, it's often overlooked, or wrong or a wrong diagnosis is made, and it's often or thought to be a cognitive disorder. And it can be, and since it's not diagnosed, it's not treated. So we do have, for our depression, um, we do give our long-term care residents a depression screening tool. We do a depression screening tool for everyone in long-term care, because we don't want to miss a depression diagnosis because it can be treated. Okay. Hormonal factors can also cause depression in women, and older people have depression can have what they call situational depression, where maybe they have the death of a family or a friend, or some loss of health or body function that they're resolving, and you can be sad. Everybody is sad at some point, okay? But the point here is that we don't want it to not correct itself. Loneliness and the side effects of some drugs can also cause depression. So we want to do things to improve the person's quality of life. And if they're experiencing depression, we can usually treat that. Now, personality disorders. Personality disorders involve rigid and maladaptive behaviors, and so persons with personality disorders really can't function well in society at all. And they include like antisocial personality disorder, and this is a chronic disorder in which the person's thinking and behaviors show no regard for right or wrong. Okay. Um, and maladaptive, if you don't know what that means, it means to change or adjust in the wrong way. Mal always kind of means bad, okay? So the person with the antisocial social personality disorder has really poor judgment, they lack responsibility, and they are hostile. They are not loyal to any person or group. The rights of others do not matter, and the person doesn't learn from experiences or punishment. Now, in borderline personality disorder, this is a chronic disorder in which the person has problems with moods, relationships, or their self-image and behavior. And this borderline personality disorders, they have intense bouts of anger or depression and anxiety that can last from hours to most of the day. So aggression, self-injury, drug and alcohol abuses often occur with the borderline personality disorder. Substance abuse and addiction. Substance abuse occurs when this person overuses or depends on the alcohol and drugs. Again, their physical and mental health are affected, as well as the welfare of others. And substances involved in abuse and addiction affect the nervous system, the mind, and the thinking. So, and the substances either can depress the nervous system or overstimulate it. So it just depends on what they're taking. Alcohol abuse, of course, it's also known as alcoholism. It's a chronic disease. It lasts throughout life. Over time, heavy drinkers actually damage their body organs, especially the liver's at risk here. Lifestyle and genetic factors are also are lifestyle and genetics are also risk factors, and some people turn to alcohol for relief from life stresses. But the craving for alcohol can be as strong as the need for food and water. And since this is a disease, there is no cure. Alcoholism can be treated, but the alcohol's effect vary with the age. And the older the person has, older persons have a lower tolerance. And mixing alcohol with some drugs can be harmful and even fatal. And of course, alcohol makes some health problems worse. Now, alcohol slows down brain activity, so it's a nervous system depressant. And so it affects your alertness, it affects judgment coordination and reaction time. Um, Now, if a person chooses to, they can have counseling. There's also medications that are used in alcoholism to help the person stop drinking. But the really person has to avoid all alcohol to avoid a relapse. Now, alcohol abuse is a little bit different when a person drinks too much but is not dependent on alcohol. It's harmful, but it's just as harmful as alcoholism. And even small amounts, like it says on your PowerPoint, it says that older persons have a lower tolerance. So that just means that even small amounts of alcohol can make a older person feel high. And then, of course, they're at an increased risk for falls, vehicle crashes, and other injuries from drinking, just pretty much like everyone else. In drug abuse, drug abuse and addiction. Drug abuse is the overuse of a drug for non-medical or non-therapy effects. And these drugs interfere with normal brain function and social function, whereas drug addiction is a chronic relapsing brain disease. And the physical effects can occur from one use, high dosages, or prolonged use. Now, there are legal drugs and there are illegal drugs, and both are abused. Withdrawal syndrome is the person's physical and mental response after stopping or severely reducing the use of the substance that's been used regularly. And then the treatment really depends on the type of drug used and the person, and it's usually a very long term process. So, while the drug creates a temporary, powerful feeling of pleasure, they have long-term effects on the brain. And at some point, the changes in the brains can turn drug abuse into addiction. So then the person has this overwhelming desire to take the drug. Okay. But both are linked to crimes, violence, motor vehicle crashes, um, and physical effects. When it talks about the physical effects, that actually can include HIV and AIDS, especially if they are using those, if they're using needles. And but it can also be from risky sexual behavior. And then, of course, other things that can occur are cardiovascular disease or stroke, sudden death, hepatitis, lung disease, and cancer, all just wonderful stuff. So, we want to educate, well, I'm sorry, I got back into the nursing mode. As far as for you, it's just, this is basically I want you to know some things about it, but you're going to run across people who have um, abused drugs in the past or have a current drug addiction. Suicide, of course, suicide means to kill oneself, and it's often linked to depression and other mental health disorders, alcohol or substance abuse, and then stressful events such as separation or divorce. So if a person mentions or talks about suicide, if they just say as simple as, I just want to kill myself, then you need to take them seriously, number one, and call for the nurse at once and don't leave the person alone. Those are the three main things right there. Um, the highest rate of suicide is really among white men aged 85 years and older. Now think about that. And then, and if someone says something and you're really not sure, then just turn around and ask them straight out. Don't just hem haw or think it's some subtlety. Say, have you been thinking about harming yourself? And if they say yes, that's the time to go get some help or call for some help, okay? Because they need mental health services. Let's see. Okay, care and treatment. Of course, when we treat mental health problems, we have to treat the whole person because they have to have some professional help to explore their thoughts and their feelings through various therapies. The needs of the total person have to be met continually, including whether it's their physical, their safety, their security or emotional needs. Often medications are ordered to help them through this process. Sometimes they have to be on them for the rest of their lives. But the care plan should reflect those needs, and what is important here is communication, non-judgmental, caring behaviors, all that's important. Communication is important. And so you must take the responsibility for your safety because, again, some of these things can turn violent or get easily escalated out of control. And if you ever work in psych with a psych facility, you learn different techniques to de-escalate when a person is getting excited, and feeding. You don't want to feed into that excitement because that escalates those emotional feelings, and we want to de-escalate them. But those are special things that you would learn in a special ability in more than this class requires. So basically, here for quality of life, people don't choose to have a physical or a mental health problem, and those that do have them deserve the same dignity and respect given to persons with physical illnesses. So again, it's right to privacy and confidentiality, right to personal choice, freedom from abuse, and provision of a safe setting. So this ends chapter 38 on mental health disorders, and I will talk to you soon.